World Meningitis Day is this Saturday, a day to spread awareness on the condition and the vaccines that prevent it. According to the Centers for Disease Control and Prevention, meningitis is inflammation of the lining of the brain and spinal cord and can be caused by things such as bacteria or viral infections. Joining us now to discuss is Dr. Mary Koslap-Petraco, medical counsel at the American Society for Meningitis Prevention, and Patti Wukovits, co-executive director of the American Society for Meningitis Prevention. Welcome. And doctor, who is most at risk for meningitis and what are some of the causes?
In my practice as a pediatric nurse practitioner, I make sure to explain to parents about the dangers of meningitis. There's 5 different serotypes that cause meningitis that we see here mostly in the United States. The causes can be bacteria, they can be viral, but meningitis causes a severe, very serious illness, infection that of the coverings of the brain that can be either life-threatening or loss of life, cause permanent damage. And now we have vaccines. We have 2 different vaccines to prevent it. Well, the big issue is making sure that every child is protected against the 5 serious strains. For 4 of the strains, we don't see that very much at all, if it ever anymore, here in the United States because the children get the vaccine. There's another kind of a strain that's called meningitis B. That's the only kind of meningitis we've seen on the college campuses in over 10 years. The vaccine is not mandatory, so a lot of parents don't even know about it.
And Patti, your daughter Kimberly passed away from meningitis. Can you talk about how that shaped you and turned you into an advocate?
Sure. In 2012, my daughter Kimberly Coffey was a healthy 17-year-old high school senior, looking forward to prom, looking forward to graduation and beginning her nursing education. She came home from school one afternoon with body aches and a fever of 101. I gave her ibuprofen. She was actually fine the rest of the day and the rest of that night. However, when we woke up the following morning, things were drastically different. Kim told me she couldn't lift her head off the pillow. She was really, really sick. And I looked and I noticed that she had some tiny purple dots on her ankles, which later turned into a rash that I saw literally go up her legs. And I rushed her to the emergency room. The doctor in the ER pulled me aside and she said, "We believe your daughter has bacterial meningitis and that the bacteria has actually infected her blood." I was so shocked because I told the doctor, it can't be bacterial meningitis. My daughter received the meningitis vaccine at 11 and the booster dose at 16. So maybe it's something else. And that's when the doctor informed me that the vaccine that Kim received only protected her against 4 of the 5 serogroups, which was serogroups A, C, W, and Y, and it left her unprotected from meningitis B. And in 2012, we didn't have a meningitis B vaccine in the United States. That became available 2 years later in 2014. Kimberly unfortunately died just a few days later, and I buried her in that prom dress that she didn't get the chance to dance in. I advocate because I realized if I didn't know that my daughter wasn't fully protected with just 1 meningitis vaccine, and I'm a registered nurse, so if I didn't know this, how many other parents didn't know as well? And that's why I do the work that I do through the American Society of Meningitis Prevention.
Patti, I'm so sorry to hear that story, and such a tragedy for your family, and so important, this work that you are doing. And doctor, what should parents know after hearing Patti's story to understand what can be done to protect their children?
Parents need to be advocates for their children. They need to know that there are 5 different strains or 5 different serotypes that cause meningitis. And they need to be able to ask their providers, is my child protected against all 5 strains? As Patti mentioned, A, C, W, and Y are the strains that that just about every child is protected against. But parents need to know about the meningitis B strain and make sure that those children are vaccinated against all 5 strains. We have wonderful vaccines now to protect the children against all 5 strains. But unfortunately, because the meningitis B is not a mandatory vaccine, a lot of providers don't even bring this up during the discussions of vaccinations for children. So that's why parents need to be aware that meningitis B is another strain, and ask specifically, is my child protected against all 5 strains? It's being the advocate for your child.
Dr. Koslap-Petraco, medical counsel at the American Society for Meningitis Prevention, and Patti Wukovits, co-executive director of the American Society for Meningitis Prevention. Thank you both for taking some time to talk to us. We greatly appreciate it.